But, if you're only dosing once a week or once every 4 weeks, then it's probably not that big of an issue, because it's not like you're going to be, going on vacation. Even if you go on vacation, you could probably work out with your doctor to give the bigger dose to cover you for 2 weeks or 4 weeks when you do that. So, but I think with the factor products, it's a nice thing that they are only, that they're room temperature stable. But that's not going to make people stick with factor.
Right. And, you mentioned that you're one of the highest prescribers for Idelvion. How would you rate the market, the reimbursement process for that drug? Have you had any issues with the reimbursement?
No, we have not had any issues with reimbursement for Idelvion.
Okay. And, moving towards the general questions, I know we're getting towards the end of this hour, so we just want to make sure, we are respectful of the time. So one last question, and Molly, then you can probably ask any follow-up questions if you might have.
Sure.
Does pricing impact...
Yeah, just 1 second. Just give me a second.
Yeah.
Yes, okay, go ahead.
Yeah. Does pricing impact the use of products in hemophilia A or B for you? Is that something that's important?
Well, that's such a loaded question, right? So, the short answer is that while I am cognizant of, the cost of hemophilia care, and while I do feel some responsibility as a prescriber for keeping costs down,
right.
When I'm seeing a patient on a case-by-case basis, and we're making decisions on what is the best treatment for this patient, we're not sitting there saying, okay, let's look at the chart as to which factor is the least expensive so that I can prescribe that one for you. We don't have those conversations with patients.
Right.
The conversations with patients are medical conversations. Which product is going to be the best for you or for your son to manage your hemophilia? And I don't, at any given moment, I'm not really thinking about the cost. We're not walking around with charts, with all the different prices for factor products. Some simple things we're aware of. Yes, Idelvion is more expensive than Benefix. We know that. Although the overall units that are being used are not as much, so there may be some mitigation by you're using fewer units per week. But the short answer is no, we're not really taking cost into consideration very much.
That's really helpful, Dr. Young. Molly, do you have any questions?
No, not really. I think we basically covered everything. But just to clarify one quick thing, so when you say you look at each case individually, you're kind of using an individualized approach then, right, or a personalized approach to determining, treatment options.
Yeah, we do an individualized approach for all the patients with hemophilia with respect to not just which product to use, but everything. Which product,
right.
Dosing, should they be on prophylaxis, should they not be on prophylaxis?
So then,
yeah.
Okay, so then when Octapharma presented their data about Newig, that's not really new then, right? Because they talk about using like a personalized approach, using the WAPPS and an individual PK profile, but that's not really different than what's already going on.
Yeah, no, correct.
Okay.
That's not different. Advate now has that MyPK-Fit, which allows patients to kind of have a sense of where their dosing is or where their levels are at any given time.
Mm-hmm.
But yeah, we are very much in the era of individualizing treatment for patients, which includes choosing the drug we want to use, choosing the dosing regimen we want to use, doing pharmacokinetic studies and making adjustments in the dose. So yeah, it's no longer, here's your factor, here's your dose, come back next year.
Right.
Right. Okay.
Okay. And just one small quick thing too, sorry. When, BioMarin is doing that gene therapy study on